Welcome to the Chaos Whispers of Healthcare, the podcast for busy healthcare leaders who are ready to get out of survival mode so they can focus on what matters most. This is where the burnout stops and the real talk starts. I'm your host, Dr. Megan Carter, and each week I sit down with healthcare innovators who get it. We will unpack the chaos, laugh through the hard stuff, and get you at least 2 practical tips you can use at work right away. If you're ready to clear the chaos and lead with impact, you've come to the right place. Let's jump in. Welcome to the Chaos Whispers of Healthcare. Today's guest is an exceptional trailblazer, female founder, and innovator. As a seasoned healthcare executive with over 15 years of leadership experience and 20 years of clinical practice in emergency medicine, Dr. Maria Granzotti is passionate about delivering high-quality care and improving patient outcomes. She's had the privilege of leading large-scale quality and safety initiatives across multi-hospital systems. She shaped strategies that drive value-based care, patient safety, and operational efficiency. Her work is grounded in a deep commitment to excellence, meticulous data analysis, and strategic decision-making that supports the health of patients and the success of healthcare organizations. Currently serving in multiple roles as a chief medical officer, chief clinical excellence officer, and executive healthcare advisor, Maria has entered my professional stratosphere just recently, and yet I already feel like we've known each other for years. I am so incredibly excited to hear all of the radically innovative and practical insights she is going to share with us today. Welcome to the show, Maria.
Well, thank you, Megan. It does feel like I've known you 20 years. It really does, even though we've known each other just a few months. So I'm impressed. Thank you for your gracious entry there. That was very kind.
Absolutely. Gosh, there's so much to cover. You have such an impressive career. So that's just the highlight reel, you guys. You need to check her out on LinkedIn. I am so glad you're here today, Maria. It's been important to me that we have a diverse group of guests who represent the many clinical leadership roles that make up our healthcare system. And as our first physician leader guest, I would love for you to share with the audience how you ended up on this innovative career path.
How much time do we have, Megan? Is what
all the time in the world for you, ma'am. Yeah. Whatever you need.
Now, I hearken back to, I always thought, one of my best friends in my entire life was my farm wife grandma, who was on a farm in Iowa. She was farm wife during the day, and then she was nurse at night. She was truly one of my best friends, and she was my inspiration to get into healthcare. So she was stubborn. I think I just admired that for her so much. She was just incredibly stubborn, but she was able to balance that caring for the family and caring for the patients, the passion she had. So I actually have her Merck manual from 1934.
Oh my gosh.
That I have in my library, which, as you know, some people don't know Merck manual, but I refer to Merck manual.
Yeah.
So that's where my passion started. And, I initially thought I was going to do internal medicine. I did internal medicine after medical school residency. And I was doing a year coverage when my husband at the time, he's passed away in 2020, but he was doing his anesthesia residency. So I took on the role of an ER teaching attending. And that, I think, was one of the best decisions I ever made. So I was a teaching attending in the ER, and I ended up practicing emergency medicine, even though I kept my internal medicine boards and my emergency medicine boards that I attained, and then my administrative medicine boards and my MBA after that. So it's been a path, and if I had to put a theme to it, continual learning, continual growing, what's around the bend, trying to anticipate. I'm very much a be prepared kind of person. That's the Girl Scout in me. So it was always be prepared, and you never know what's coming. And I think that that's really influenced my career.
I love that you said you never know what's coming, because when you think about the role of an ER physician, could there be a more perfect slogan for that? Because you'd never know what's coming through those doors.
You never know. You never know. And I think that's why I loved emergency medicine so much, because there was such variety, and you really had to be present and rely on not only your skill sets, but your team skill sets. I loved that team-based model. So I think that parlayed then into my executive leadership.
That's amazing. That's amazing. Thank you for sharing that. And thank you for being courageous and vulnerable as well. Sharing your story is powerful, And I know there are so many listeners who will appreciate you even more for doing so. So can you tell us about your most chaotic moment in healthcare leadership?
Oh my gosh, I have to rank one.
Yeah, I know you probably got
Hard.
several, I'm sure.
I think probably one of the first ones, I'll go back to that. One of the first ones, I became my first chief medical officer role was around 2009, 2010. Okay. I tell everybody I'm 24, but that was my first chief medical officer.
Love that.
And I remember it was one night, I was the only physician in the ER, have a group of, 3, 4 nurses in the ER. We had about a 250, 275 bed hospital, community hospital. And we get a school bus of all things who has a pregnant teacher on the school bus. I mean, it was late, late, late at night. They were coming back from a trip, some type of outing, and a bad car accident. So, we stand up the trauma protocol. We get all the teams on deck. We're communicating. Again, this was back in the 2010ish or so. And really, lots of times in healthcare, your instincts take over. And it's okay. It's good to do that because your gut's telling you. And I can remember, let's just put them all in. I was directing traffic, and let's put them all in one room. We had a room we could double and open and spread for these kinds of incidents. And we had 20 special needs kids here that are ages 4, 5, 6, hard to tell in some. And you just start taking over. So talk about chaos, right? Talk about chaos.
No
So
kidding.
I just started instinctively, okay, I'm going to, survey the area. You're looking for blood. You're looking for respirations. You're looking for movement. Just kind of takes over. And I just wanted to get across that instinctual piece because oftentimes we forget or to honor that instinctual piece when we get into more administrative or leadership. It still needs to be there. It still absolutely has to be there and apply it. It may be applied in different ways, but that instinct, as you continue to learn, you continue to grow, you hone that chaos is actually beneficial for you wherever it may be, whether it's in the clinical setting or it's in the leadership setting. Take that for the blessing that it is, and learn and grow from that. Yes, I'm glad to say we had everybody was great. It took, took us about 2.5 hours, but parents came, staff came, administration came, and, everybody did very well, let's say.
That's amazing. That's a perfect case study for an emergency management drill. We do these drills in our organizations, and what a great case study and great outcomes thanks to your instincts. I want to revisit just real quick what you said about, I call it a doorway assessment. You talked about when you step back and you wanted to you're literally looking at the forest for the trees initially. Mm-hmm. And I remember talking to one of my new grad nurses way back in the day when I was training them. And I said, sometimes we're in a hurry task wise to just run in the room and start doing things. I said, I love to start my shift. I'll stand in the doorway for a few seconds and just observe my patient, whoever else is in the room. And you take in a lot of information consciously and subconsciously by just pausing and looking around. And you can usually, especially to your point, when you've been doing it for several years, you can usually pick up on things that your monitor or your chart are not telling you. So I love that you
no,
gave
absolutely.
that example.
It's interesting. You make me think back to whenever I was on a ER shift, I always fought for the seat or the space where I could get the best view of the door coming in, because it didn't matter if it was an ambulance coming in or if it was a patient family walking, however their mechanism to get in. That told me so much.
It does.
So much. So just using all your senses, like you're saying. Yeah.
I love that. And I love that you tied that into leadership as well. One of the pain points, I'm going to pivot for just a second. One of the pain points I know our audience faces is related to the insanely rapid pace of change in the AI landscape, especially in healthcare. It feels nearly impossible for any healthcare leader to know which tools are best for them, how to keep the humanity in healthcare while using it, or even the basic terminology. So before we talk about solutions, can you share with us how the chaos and confusion of the AI landscape impacted you?
Yeah. And in this, I'm not practicing clinically anymore, front bedside, but, I think back to the days with all the literature coming out now and all the studies and all the tools coming out and all the concerns and non-concerns and promotion and non-promotion. I think back to when we first had those clinical like alerts, allergy alerts.
Yeah.
And people like to say, okay, this is clinical decision support. Well, yeah, it is, but there's just so much more. So I've been looking forward to this trajectory. And I knew it would be based on what are we doing with our data? Excuse me, access to the data.
Yeah.
You can tell I'm excited about this.
Yeah.
Access to the data. And there's just so much potential here that I was actually asked to teach at the AAPL, which is the American Association of Physician Leadership in Boston last month. They asked me to teach on transformation of healthcare with AI. I taught a group of about 29, 30 physician leaders that were there, all kinds of, we were all over the place as far as foundation. That was the whole purpose of it, because folks they see the shiny object, they see the shiny car, they want to jump to that, and they want, in the interest of their patients or their workflows or their efficiencies or their outcomes, but they're not getting on the ground level of what it means. As far as talking with folks, getting a standard baseline just on definitions itself, just on the definition of AI and what it means. And you can go into approaches, you can go into types, you can go into machine learning models, you can go into key applications. But the key point being that some of these models, as in supervised learning, are built on actual A to B, trajectory, algorithmic, directed, specified pathways. Whereas other types of machine learning models are more about, let's just see what the pattern is and pick up. Let's just see what the information or data is trying to tell us, and it more natively can generate the answer rather than having it so scripted. That's the exciting piece right now. And so when people are thinking about AI, first of all, when somebody says AI, you have to really dig in and say, okay, what do you mean by AI?
Right.
Is it supervised, unsupervised? What type of machine learning model is it? And what type of sensitivity or specificity does it actually carry with it? In healthcare and implementation, we have to be very, very careful going back to the basic foundational question of, what's the question I'm asking? What's the problem that I want to solve? Because it's going to be unique by institution. So one application may work at one institution or one clinic or one department versus another. It's not going to work because the sensitivity and specificity isn't what you're looking for, isn't what the answer, it's not supporting the answer that you're trying to get at. So I know that's a very long-winded answer, Megan, to that.
Yeah.
But
no, you're good.
It's an exciting space. And if we approach it not only with baseline foundational understanding of what AI is to begin with, and then what are the tools out there to assess how good it is, how accurate it is, et cetera, where it's the right application. And then the governance, the strategy and the governance and implementation, that's where a lot of people are stumbling right now, because they're and I don't blame them. They're grabbing for what's out there, but not really understanding what does it mean to their workflow, or what does it mean to their teams in their outcomes.
Yeah. Thank you for that. No, I think that's powerful. And I love that you highlighted asking the basic question first. If I'm an executive leader or director manager and I have a problem to solve, starting with that first before I'm having a vendor or an outside tech company come in and start, doing this really fancy, impressive, exciting presentation. It really needs to start further upstream, which is here as a healthcare leader, here's what I know my organization struggles with. Whether it's a metric, people, process, whatever it is, this is what we struggle with. Then inviting those vendors or people who know the tools to come in and say, how can your tool help me solve that specific problem? And the reason I think that's important, like you stated so clearly and eloquently, is there's so much out there that one can get overwhelmed with the options and possibilities. And so you really want to be clear about what is the problem we want it to solve. And really, most of us in healthcare want AI to take off administrative burden, the non-essential work, for the purpose of giving these clinicians more time at the bedside doing what they're trained to do, not to replace them, but to support them and free them up. And so we need data to be able to do that, to your point.
Right. Right.
So
Data is definitely the new commodity. There's no question.
is.
Some people even argue that it's not that new of a commodity. It's been out there.
Yeah.
But and you hearken to this, is that people are so ready. We're clinicians, right? We're so ready to fix. We're so ready to get it done, to get the answer. We can't jump to solutions without understanding the problem and how we're going to get there. Because if we don't understand the problem, we're going to be circling with the solution.
Right. Yeah. So at the highest level, let's talk about AI governance structures in healthcare, because I know, having been to conferences and working with clients around the country, organizations and individuals are at different places in their journey, right? Some of us need to know basic terminology. Some people understand the basics, but now they're trying to set up these more advanced governance structures, considering ethics. How do we keep the human in the healthcare, that sort of thing. So how can these leaders make sure that they have a seat at the table and that we're keeping the human touch in healthcare AI implementation?
Yeah, I mean, that's a great segue to that. At its core, we have to understand how AI is impacting our outcomes with quality and safety. I think that there's just so much runway onto how that can truly be deciphered and implemented. And with AI, the strategy and governance of it, first of all, if you start top down, you really need to tie it to your organization's strategic goals, values. You can infuse that in your AI approach. It's not the separate, machine that's living out there. It's integrated. You want that human in the loop integration of whatever AI models you choose. And a lot of approaches are, you don't have to start house-wide, let's say. You can start small. You can start implementation small and start to transform your healthcare, whether it's with remote patient monitoring, for an example, whether it's, let's say you have a chest x-ray type of AI application that can help to automatically measure nodules, for instance, lung volumes, et cetera, that can take so much of that kind of that daily standard work, but very important key standard work to modify how your outcomes are. And then some folks, it's interesting right now because some folks are making, or building, let's say, kind of an AI governance within their institution, depending on their size, depending on their specialties, depending on their core capabilities, that are the one thing that's very key is that it's very multi-representative. You've got nursing at the table, you've got, just making it up, you've got lab, you've got critical care, you've got ER, depending on the application, but you want those outside eyes because really anything we do in our organizations has the potential to touch the entire house. So really thinking about what that structure looks like. Sometimes that governance committee, obviously you have to have ethics. You talked about the ethics. Mm-hmm. Okay, the ethics on who's using the AI and who's not, the end user itself. How are you going to assure that? The cybersecurity behind it is massive. A lot of folks aren't shoring up, or they have and they think they have, but really haven't. The cybersecurity piece is huge, especially as we start taking more data from wearables, monitors, et cetera, extending outside of your institutions, that kind of thing. The other thing is the regulatory piece. The regulatory piece, there's a lot of moving parts right now, and there's going to be more to come. I mean, every other day I see new documentation on a regulation that they're getting, they're wanting comment on, et cetera, et cetera. But really bringing it back to your organization's strategy and values and approach. And what do you need to work on? Again, what's our problem? What's our issue? And focusing on that.
Yeah, those are important questions to ask, and I think factors to consider. If I'm a busy healthcare leader and I'm listening to this podcast and I would like to have either resources, whether that's professional organizations, reliable, schools of thought on this, where would you direct me to go to get to stay up to date on what's happening with AI in the healthcare landscape? What's safe and reliable?
Yeah, what's safe and reliable? There's a lot out there, as you know, right now. For instance, one of my co-founder and I attended Health 25, and that was a good kind of visibility into, oh my gosh, never thought about this angle, or oh my gosh, never thought about this. But then it's also your society publications. A lot of societies have been able to get on. I know the AMA, I know ACEP has some literature, but your individual societies or your professional organizations, they have vetted and will have looked at different pieces. The other piece that I get some very interesting information, and you can start contrasting and comparing, is on LinkedIn. There are, I'll say, a million folks, loading information on AI. The other piece that's really good for information is HIMSS, HIMSS. HIMSS has some great information and access to various models and more on the application side because of the IT integration needed. But those are just some, people typically have their tried and true, source of truth access, but I think societies are great. Your favorite journals are going to have a lot in there. And it's more about keeping your eyes open and understanding what's out there.
Yeah, I love that. I'm glad you mentioned HIMSS because I do know that they recently, I say recently, relatively recently, came out with the 5 rights of AI implementation. So if anyone's not familiar with that society, I'll add that in the show notes, a link to that. But they're a great, reliable, trustworthy source of information on AI as it continues to transform our landscape and our leadership practice. Absolutely.
And what's interesting, there's some groups now that have been formed recently. There's just so many, I'm not going to name them, but that are trying to standardize an approach to how to assess a tool or assess your governance structure. Let's say there's a lot of literature out there because people are understanding we have to have that architecture in place to be able to. The quality assurance piece is massive with AI, so just those checks and balances.
Absolutely, absolutely. I am just blown away by how much you know about AI. Maria, doesn't surprise me, but it's incredible how much you've been able to learn and what we can learn from you. Thank you for sharing all this knowledge with us. I like to pivot at the end of the episodes to take us on a lighter note and tell us, what are you reading, watching, or listening to right now to keep the laughter in your life?
Oh my gosh. Okay, now you're going to laugh at this, right?
No judgment.
I'm a huge, absolutely huge. I went to Notre Dame undergrad, and I'm a huge sports fanatic.
Yeah.
So anything in the playoffs, I will watch, whether it's football, basketball, soccer, World Cup, whatever. WNBA is just absolutely awesome, I will say.
Inspiring. Yeah.
And, but to keep the laughter going, because I'm trying to okay, you need some balance. It's not just all about sports. It's not just all about, work. And, I think that the one entity I do want to mention that I work for Church Streeter and Cross, which is a talent acquisition and technology company. And they have some AI models that they use themselves, which is part of what attracted me to them and their founder.
Yeah.
But given this, I don't know what it is, but this human resources piece and this networking piece, I'm actually learning Italian. I found this great. I knew some Italian. I'm half Spanish, so it's easier for me to get these Romance languages. But I found this great app called LingoPie that's got AI in itself. Again, trying to use this every day, and it's really teaching me back and forth. So I'm trying to learn Italian right now, Megan.
That is fabulous. I love that. It's funny you mentioned Italian because just yesterday, I talk a lot about my son being 15 and being, Gen Z / Gen Alpha. He's right on the line, and how his sense of humor is so different. And a new type of humor I learned about yesterday is called Italian brain rot. And it's these short videos of AI generated images, and you hear a voice speaking this really excited Italian. They're not real Italian words. They call it Italian brain rot because it's an Italian accent, and they kind of sort of throw some in there, but it makes these kids laugh. We're talking kids like from age 7 up. And they scroll through these images and these videos with this guy, narrating it in this excited Italian, and they are crying with laughter. And I see it and I'm like, I don't get it. I don't get it, but it's making them laugh. So then as a parent trying to be technologically responsible, it's like, tell me what makes you laugh about that. I want to make sure I'm not missing something potentially dangerous. But you can just Google it, check it out, and see what these videos are. It's very interesting. Maybe it'll add to your Italian.
Oh my gosh. I hope that's not the one I'm trying to learn from. Let's just say.
No, definitely not. No, yours sounds way more reliable for sure. Awesome. Well, thank you for your time today, Maria. I'm so excited for our listeners to hear this incredible information, and you've given them some great tips on where to start to up their game on learning the terminology. Where can they find reliable information and stay up to date, and how do they begin that conversation if they haven't already in their organizations?
Well,
if
thank
our
you.
listeners, if our listeners want to connect with you further, where can they find you?
They can find me on LinkedIn, Maria Granzotti. I'm easy to find there. And the AI, we've scratched the surface, right?
Oh, for sure.
There's just so much, but it's just having the interest and thinking, okay, we can do better. That's the start.
It is 100%. I love that. Thank you for your time today, Maria.
Thank you.
Awesome. Thanks for joining us on the Chaos Whispers of Healthcare. If today's episode resonated with you, please be sure to follow this podcast, rate, and leave a review on your favorite platform. I'm Dr. Megan Carter, and I will be back next week with more real talk, fresh strategies, and guests who are redefining what it means to lead with impact. Want to keep the conversation going? Be sure to connect with me on LinkedIn and download free tools and resources from my website. Both links are in the show notes. Let's heal this broken healthcare system together, one day at a time.